Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Physostigmine. Physostigmine will increase the intestinal and bladder motility, and it reverses the CNS effects and the cardiac effects of tricyclic antidepressants. It also reverses the CNS effects of atropine. This physostigmine is an uncharged tertiary amine. Because it is a tertiary amine, it is lipophilic and it can cross the blood brain barrier, and thus it penetrates into the central nervous system.
thank you and thank you for watching.